Before we get started, let me introduce myself. My name is Dr. Bemnet Hailu, and I am a board-certified general pediatrician. Telling you a little bit more background about myself, I initially was born in Addis Ababa, Ethiopia, and came to the U.S. with my immediate family at the age of 4 years old and was raised primarily in Maryland. I earned my undergraduate degree in general biology from the University of Maryland, College Park in 2007, and went on to attend St. George's University, which is located on the Caribbean island of Grenada. There, I earned my dual MD and MPH degree in 2013. I then moved to Chicago to pursue my pediatric residency program and still reside here to this day, currently working as a locums or traveling pediatrician. Working with children has always been a special interest of mine, along with public health and global health initiatives. So when this opportunity to work with and collaborate with Abasha Health came along, I was more than eager to get involved. So today's discussion is going to be centered around helping your kids thrive through the difficult times in which we're living with COVID-19. Let's get started by discussing the key points in the blog post that I wrote and can be found on our website on abashahealth.org. If you didn't get a chance to browse this post, that's not a problem at all, as I'll be reviewing some of the key principles and discuss that with you all now. So the blog that I wrote is broken down into several major sections. So we're going to talk about different topics such as helping your children with their sleep routine, with food intake, with exercise, making sure their emotional health now as well as any other time is on track, as well as physical activity and social life. So starting from the top, first and foremost, it's very important to make sure that your children have their annual well-child checks, more so now than ever before. You know, with the last couple of months being so difficult in different ways for many people, it has been very challenging for children and even adults to see their doctors routinely. So remember, above age 3 years old, each child should be seen annually for a routine well-child check. That's to make sure that they're growing appropriately and all aspects of their health are on track, as well as making sure they're up to date with all their vaccinations that they may possibly need. So, moving on to the next part of their health, sleep routine. So with the summer months and definitely quarantine, we as medical professionals understand that, of course, things are probably been off track, but it's really, really important for kids to get their adequate rest at night in order to function for the day and make sure they're ready to learn and go during the times that we're living. Keep in mind that a lot of sleep issues, such as lack of sleep, could lead to potentially behavioral issues as well that may be misdiagnosed rather, as hyperactivity or attention deficits. So putting away electronic devices at least 1 hour before bedtime, giving kids an adequate amount of time to kind of wind down and get back into their normal sleep routines. Avoiding caffeine or stimulating activity before bed is another way to ensure that they have adequate restful sleep. So moving on to talking about food intake, so there are some key things that we're going to talk about. Every child should have, or at least work to having, 5 fruits and vegetables a day. So that is the goal to living a healthy life. You want a well-balanced diet of at least 3 meals, so breakfast, lunch, and dinner, with 2 healthy snacks in between as well. This will make sure that your child has the adequate energy to get through their day and learn appropriately. Okay, so moving on to physical activity. So physical activity, you know, with the ongoing pandemic that we're living in right now and earlier stay-at-home orders, it was very difficult to make sure that not only your child, but the family as a whole is staying active. But I think that's the most important thing to know, that physical activity doesn't have to be necessarily completed outside. So making sure that you as a family can do, creative ideas like online, different virtual workouts with the whole family, trying to do a family walk in the evenings after dinner. These are just some key ways to kind of get more ideas to doing things as a family and encouraging your child to stay active as well. So, one of the most important areas that I wanted to make sure we emphasize today in our talk is working on emotional health. It has been an overwhelmingly challenging time for everyone in the world in different aspects. Children are definitely not left out of that equation. So more so now than ever before, it's so important to do those check-ins with your child, make sure that their mental health and spiritual well-being is intact, making sure to make time to have those times after dinner, whether it be a weekly check-in, whatever works well with the family schedule, to make sure that you're really in tune with your child, and asking them just straightforwardly, is there anything you're worried about? How are you feeling today? And make sure it's an important thing that you can actually check in with them and make sure that they're doing well emotionally, not just physically, with food intake and getting their annual child checks, but even more so now with all that's going on in the world. It could be very difficult to process that in a child's brain. So delivering age-appropriate information and limiting their social media use, as well as their exposure to negative media and things like that, is so important during this time as well. So, social life, we know that during this time, whether your child is determined to be staying at home and doing virtual remote learning or going back to school, it's so important to connect socially with others and their peers as well. So having that designated time where you can take breaks and having them learn different things and connect with their peers, whether it be, every Friday afternoon, they're meeting up with their neighborhood friends virtually to kind of connect. That's so important to do as well. Overall, I think some key points, the way you can remember these topics that we talked about today is 5-2-1-0. So this is the American Academy of Pediatrics way to encourage a healthy and promote a healthy lifestyle for children. So that 5 actually relates to 5 fruits and vegetables a day. 2 is 2 or less hours of screen time, and we know that this is difficult during this time because a lot of the learning is done virtually. So making sure you do that 2 or less hours of what we call recreational screen time. So, playing video games, things like that. And also taking the time in between the virtual learning day, maybe 10 minutes breaks here and there, because we know that in order to function optimally, children do need those breaks to kind of release that energy as well. 1 is 1 or more hour of physical activity a day, and 0 is the goal of 0 sugary drinks per day. So we know that that's all empty calories and not really helpful to your child to grow stronger and healthier overall. So aiming for that rule, pass that information on to others. 5-2-1-0 is our goal in the American Academy of Pediatrics. So overall themes as well is structure. We know children thrive on structure, so it's really important when they know what's expected to come of them, what is expected to come next from their day. So drawing out a schedule with your child so that they know that, after this many hours of virtual learning, they're going to get a break, taking those 5 or 10 minutes to play tag outside, dance, walk the dog. Just some quick movement activities will help to have your child engaged as well and do well in this different times in which we're living. Also creating an adequate study space in the house, so we know help with that structure. We know that when they go to that area, that they know that that is where they're expected to be focused and diligent on their work as well. So whether your child is attending school in person or virtually, make sure you're providing some COVID-related advice. Make sure you're providing them with multiple cloth face coverings and label them actually so that they're not confused with another child's items. Practice putting on and taking off the mask with your child. Also, children learn best by modeling, so making sure that you're doing it with your child so they pick up the good habits from you as well and know that this is something that everyone's doing to stay healthy. Reminding them that they should wash their hands before and after putting on the mask, and reviewing coughing or sneezing etiquette is essential as well. keep in mind that maybe you might start virtually, but things might move to more of in-person basis or vice versa. So preparing adequately for those changes as the respiratory flu season comes upon us. We're not sure in which direction the pandemic is going to go. So just being prepared adequately on a family level will help alleviate some of that stress as well. So let's get to some of the questions that were submitted and make sure that we reviewed all of that information adequately. All right. So in regards to emotional health, some coping skills parents can teach their children is something that I mentioned earlier. So talking it out with your child, making sure that you have that emotional connection with them. Some coping skills could be that actually just important to acknowledge their feelings, acknowledge that it is okay to feel this way. It is something that is collectively happening to everyone in the world, and just really acknowledging whether they may be sad or mad or angry, and helping them to be involved more in activities that bring them joy, that bring them happiness, because we know that once we're able to focus on the positive, then the negative can be a little bit more tolerable as well. So someone else had asked, what tips do you have to keep children engaged and motivated during virtual learning? So I think this comes down to structure as well as giving adequate breaks. So even in an adult mind, it's hard to keep motivated and keep focused and concentrated on the task at hand. We know that if you do something like every hour or so, taking a 10-minute break to stretch, walk around, take a walk, all those things are really, really going to go far as making your child have a successful academic year. And so the next question is in regards to additional screen time that the virtual learning does put on parents. We know that that does cause an additional time span for that to be kept and spent on learning and having screen time. So that 2 hours or less of screen time is taking into account recreational additional activity. So as much as possible, really trying to prevent things like headaches and having vision issues from staring at a screen too long, just trying to limit that recreationally. But we know that you have to do what you have to do when it comes to the academic learning and changing with the times of everything being via technology now. And last final question is, what is the appropriate age for children to start wearing masks in public places? So this is an important topic as it relates to COVID-19 of what is going on now. So we know from our research and from developmentally speaking, children over the age of 2 years old have the mental capacity and also understanding to be able to keep a mask on their face and understand the purpose for it. So that magic number is 2 years old and above, and that's because we know that younger children may not be at a developmental milestone where they're understanding enough or able to keep that in place. So going back to some of those tips that we talked about earlier, modeling behavior with your child, and also giving them, adequate instruction as it relates to hand washing frequently for at least 20 seconds, having hand sanitizers handy and things like that, okay? All right, so that brings me to the end of my discussion. Thank you so much for joining me today to discuss your child's health.